The quality of life of breast cancer survivors is defined as a perception of wellness. The major components of quality of life are health and functioning, psychological, spiritual, socioeconomic, and family. That woman who has to deal with all of these areas of her life suddenly now has breast cancer thrown on top of it with its own set of demands. Quality of life becomes a very important measurement that can indicate how successful a woman is in dealing with all of those demands in her life and in her survivorship also. I noticed that there was a hole in the literature regarding Latina women, especially since the incidence of breast cancer among Latina women is not as frequently seen as Caucasian women. However, it is a leading cause of mortality in that group. My findings indicated that social support and uncertainty were significant predictors of quality of life. And social support had a positive influence on quality of life, and uncertainty had a negative influence. Something as simple as including a family member or a few family members, if it was a necessity, in certain aspects of their care. And also recognizing other sources of support that maybe the Latina woman wasn't aware of. Group support with the American Cancer Society, as an example. Many families live at or below the poverty level. So not having the economic resources that would help them to comfortably go for early screening regularly. That could be a problem. And also lack of health insurance. For the Latina population, those factors have been documented and have shown to hinder the screening efforts. And as a result, the Latina tend to be detected when the disease is in a later stage. The survival rates for the Latina breast cancer survivors is lower than Caucasians. So nurses need to pay attention to the Latina breast cancer survivors, in particular, to find better ways to meet their needs, culturally sensitive ways to meet their needs, and not assume that they may be doing just as well as Caucasians. We, as the healthcare professionals, need to plan interventions. Some ways that this can occur is more culturally sensitive awareness of the breast cancer survivors' needs. If there is a language barrier, to be able to provide interpreters, for example. Being able to provide health education materials that are suitable to their education level and also to their language. Political activism on the part of healthcare providers is important. Nursing has a long history of lobbying for better healthcare, better access to healthcare. Cultural sensitivity is something that is easily brought about in the healthcare provider, and I think that an improvement in cultural sensitivity in nursing, in physicians, and all members of the healthcare team will help to improve support, and those factors then can have a better influence on quality of life for the breast cancer survivor.